we'll do the BCA later on. Uh, Whoever is remaining, you ask them later on, and we'll do it after. Please. And your back.
Yeah, yeah. Sorry.
Check one test.
ये भी और कॉलर में
ये मेरे को चाहिए, ये हो गया।
कॉलर में दे दो चालू चालू
सॉरी, चालू हो गया कि नहीं हुआ है?
दूसरा फर्स्ट
Can you call her? Sneha. मेरे फोन से कॉल करने बोला ना, डॉक्टर विधि को कॉल करने बोला ना, आ गए। Everybody please settle down. So we'll start with the program now. Okay, so before we kickstart today's program, start program. Okay. So, okay. Before we kickstart today's program, my name is Ria Karya. I am a bariatric nutritionist at Asta Healthcare and host for today. So today I welcome each and every one of you for this beautiful event. In this event, we'll cover so much aspect of what is obesity. In today's time, the major pertinent issue which is there in contemporary times, that is obesity. And we all know in India, again, it is an alarming state where each and every household has like obese patient in them. And today we'll start with this event. So I would like to call Dr. Manish. He will speak on obesity and its treatment and how to grade the obesity as well. And
Can I have silence there, please? Excuse me. आवाज नहीं please अभी. Hi friends. Volume. So very good morning. Is it morning still? No, it's a very good afternoon to everyone. Such a pleasure to see such lovely crowd on a Sunday morning. And आज का जो प्रोग्राम है वो है एक ओबेसिटी अवेयरनेस सेमिनार एंड a support group meeting. So do you understand what is the meaning of a support group meeting? What is a support group meeting? हाँ जी. Okay, Dr. Saab says a group where people with similar complaints come to know about each other's problems and this helps solving that. Okay, post-bariatric surgery. Anyone else who wishes to speak on what is support group meeting? Sir, दूसरों को भी चांस दे देंगे. Yes. Anyone else? Yeah, anyone else? हाँ जी. Spreading health awareness. See, yeah, बोलिए.
तो ये जो बैरिएट्रिक सर्जरी इसका अवेयरनेस तो बहुत कम ही है और दूसरा एक कि बैरिएट्रिक सर्जरी के बाद पेशेंट और उसके रिलेटिव दोनों में बहुत सारे क्वेश्चंस भी रहते हैं, बहुत सारे एंजाइटी भी रहती है, तो वो यहाँ पे सॉल्व करने के लिए उसको सपोर्ट देने के लिए ये सपोर्ट ग्रुप है.
Fantastic. So friends, obesity is a huge medical problem. And the ones who have consulted me earlier, been with me, got operated by me, have heard this sentence umpteen number of times. मोटापा एक medical problem है. Obesity is a huge medical problem. And every medical problem requires a scientific solution. Am I right? Every medical problem requires a scientific solution. But obesity is such a medical problem जो सिर्फ आपको फिजिकली तकलीफ नहीं देता है, सिर्फ मेंटली तकलीफ नहीं देता है, साइकोलॉजिकली भी तकलीफ देता है एंड उसके साथ एक बहुत हद तक इट आल्सो अफेक्ट्स योर कॉन्फिडेंस एंड प्रोडक्टिविटी. So obesity is a medical problem which has so many facets. And if there is a medical problem or a problem which has got so many facets, so the treatment cannot be one straight line treatment. किसी को अपेंडिक्स की तकलीफ हुई, हमने अपेंडिक्स ऑपरेट कर लिया, पेशेंट इज ओके, गॉन बैक होम. हर्निया की तकलीफ है, हर्निया ऑपरेट कर लिया, पेशेंट इज ओके, गॉन बैक होम. लेकिन बेरियाट्रिक सर्जरी वैसे नहीं है. ओबेसिटी के साथ अगर इतने सारे प्रॉब्लम्स जुड़े हुए हैं, if there are so many medical problems which are associated with obesity, then the treatment is also going to be a multi-pronged treatment. And one of the mainstays of that multi-pronged treatment is a support group meeting. And we do this on purpose. So we have lots and lots of patients uh, who have diabetes and obesity. So we would have treated thousands of patients who have had uncontrolled diabetes, like 100, 140 units insulin लेने के बाद में sugars are up to 300 and 350. And 99.9% of the patients who have been operated are off insulin, and 99% of the times off oral medicines also. So obesity treatment or bariatric surgery is a scientific solution where ना सिर्फ आपका वजन कम होता है, बट उसके साथ आई हुई बीमारियां भी एक एक करके शरीर से निकल जाती है. But these surgeries are not done randomly. For example, if I have got a young girl who's unmarried, or a married girl who is not yet become pregnant but she wants to complete her family, I might go only for a sleeve gastrectomy. I've got some patient who requires say 80 to 100 or 150 kgs of weight loss, I might go for a gastric bypass. If I have some patient who requires 70, 80, 100 kg of weight loss, or even 30 to 40 but is a strong diabetic, I will go for a mini gastric bypass. So there are categories of surgeries and there are types of surgeries which we do to ensure that the right patient gets the right treatment at the right time so that we can get the right result. And what is your expectation? What do you expect out of this? So one thing should always keep in mind, that we are never looking at sudden weight losses. So even those who have got operated in the last week or last month who are over here, please bear this in mind. We are not looking at sudden weight loss. हमें ये नहीं चाहिए कि आज हमारा सर्जरी हुआ and tomorrow we should lose weight. It is not like that. We calculate weight loss only on a monthly basis. You've got operated, fine, but our goal is 6 months, 8 months, and 1 year goal. And after that 8 months or 1 year goal, then we have annual goals of how do you maintain yourself and how you adapt to a new lifestyle. But don't expect that you will lose everything in 1 month, because that is not what surgery is all about. It is not a quick fix solution. It is the right treatment for the right stage at the right time. So what we expect more or less is the person should lose somewhere between 7 to 10 or 12 kgs in the first month. Patient should lose somewhere between 3 to 7 or 8 kgs in the second month, and then 3 to 5 kgs per month till the time the patient reaches the weight that we have thought for them. Because especially in females, if we try to even have a sudden weight loss, what you're going to have is severe hormonal changes. So everything is planned. There are no surprises. So I plan exact size of the stomach that is to be cut. I plan the intestines which are supposed to be bypassed. I plan how much weight loss should happen every month. It is not going to be a surprise कि अरे ये महीने में कितना weight loss हो, I don't know, or how much will happen. It's not a question mark. Everything is already there on paper with me, and I know in how many months you're going to come down. So when some patients come and tell me that in the last month I lost only 3 kgs, so that is because I expected that. There are going to be times when you're going to have inch loss, there are going to be times when you're going to be having weight loss. So it's all okay. Final goal is that you reach the weight that I have decided for you, and then I help you, counsel you to ensure that you go into a lifestyle that you maintain it for years and years to come. So something about the surgery which everyone knows, and for those who have just got operated either at Breach Candy or at Asta in the last week or last 2 weeks, you all would have noticed that there is no bed rest required. Since it's a laparoscopic surgery, most of you all had started walking the same evening. Am I right? Most of you all had started walking the same evening. By next day, you all were going up and down the stairs. Everyone was moving around well. And within 1 or 2 or 3 days, you all were back to normal work. Yeah.
I was your patient. I remember I didn't use your bottom. I went myself to the washroom. I
Okay.
remember that.
So she is like most of her patients, and she also feels so proud to say that she got operated in the morning and she didn't take a urine pot. She directly went to the toilet. That's good. So these are the small things actually which matters for every patient, because these are the queries which come to us to refer patients to Asta Bariatrics. So they refer patients. So orthopedic will refer a patient who is say 90, 100 or 120 or 150 or 200 kgs and says that उनका knee replacement करना है, but पहले जाके weight loss कराइए and then I can touch the knee. 90% of the patients don't require such surgeries later until unless it's a permanent damage. Yes, please tell me. Oh, thank you so much. Thank you.